Brain tumor can be found in people of all ages, starting from a child all the way to the elderly. However, it is mostly found in adulthood. Generally, tumor in the brain occurs less when compared to other parts of the body, such as tumor in the lungs or breast tumor. Therefore, the proportion of brain tumor occurs in a person is relatively less. Despite the low possibility, to be aware of a brain tumor is just as essential as when it occurs in any parts of the body, because brain is the organ that controls the entire body. A tumor in the brain can cause an abnormality, which will result in the patient to be disabled. Signs and symptoms that indicate tumor in the brain comes in various forms. However, a specific type of sign would be when the severity of the existing symptoms progress and the clinical condition of the patient declines over time. The patient may experience headache combined with nausea or seizures, especially those who had never experienced it before.
Brain tumor is the abnormal mass or tissue that found intracranially. Usually, it can cause the symptom by got the pressure or at the site that got the abnormal function of the brain. The symptom of the brain vary from usually headache, nausea, vomiting, confusion, or sometimes decrease of ability to doing something. And when the mass hit in the area of the brain that control light, control the movement, or control the speech, or control the ability of lighting, it can cause the symptom. So the common symptom and sign is headache, nausea, vomiting, and sometimes seizure, got a seizure attack. The symptom like a headache or nausea, vomiting, not everyone will be a brain tumor. Sometimes it's from other disease. But if the headache is happen again and again, not improve and worse, have a double vision, or have a loss of ability to do something, or get disability, or cannot speak, or hearing is decreased, sometimes you must to consult with the physician.
Like other tumors that are found in our body, oftentimes the definite causes of their occurrence is unknown. But there are certain groups of patients that develop tumor due to inherited genetic mutations or exposure to radiations in younger age.
The causes of brain tumor is depend on many factors, but we believe that mutation or defect in the gene cause the abnormal growth of the cell in the brain is the cause of brain tumor. There is some environmental effect that we found that have a problem is exposure to radiation, like from treatment of another tumor, or sometimes from the environment, and some chemical substance can cause the problem also.
As brain is a crucial organ in our body, despite of the brain tumor being benign or harmless, or malignant or cancerous, leaving the disease untreated could lead to serious illness, which is why brain tumor is considered as a dangerous disease.
Abnormal mass in the brain usually have a two types. Sometimes it's a cancer or called malignant. It can grow quickly. But the other is not cancerous, it's a benign. Usually goes slower than the first. Abnormal mass can grow from the cell in the brain, but sometimes some spread from other part of the body, like from the other malignancy, like from the breast or from the chest. And the rate of growing, it depends on the type of the tumor. But usually malignancy is grow quickly.
Currently, there are different ways for treatment, whether it will be surgery or radiation, depending on the type of tumor, which needs to be properly diagnosed. The investigations are typically done by imaging studies. If the tumor is more aggressive, it may appear swollen. Other types of tumor that have slow growth may not be as obvious to detect. Those patients need to be closely monitored over time to be able to distinguish brain tumors from other abnormality that may develop in the brain.
Usually diagnosed by history and physical examination. Like you have a symptom, headache, vomiting, or sometimes have a neurodeficit like a weakness, confusion, and sometimes instability for movement. And then we did investigation by CT scan brain or MRI. The characteristic of the mass in the investigation like CT or MRI can tell that it's spread from other malignancy or it's primary in the brain. In the investigation, it have many masses. Usually it's from a spreading from other and it's a malignancy. But the primary tumor of the brain, in the investigation, it can tell by characteristic of the CT and MRI to tell that it's benign or malignancy. But the exactly is sometimes get the tissue for pathological diagnosis. Treatment option sometimes is only observed because a benign tumor is slow going. If the tumor is not affect the neurological deficit and it is small, sometimes no need to do anything, only observation. But it can cause the problem like the mass increase, got an increase in intracranial pressure, it need to remove it. If it got increased intracranial pressure, it made the patient unconscious and sometimes got the brain dead if not remove it. The other problem is it happens nearby the vital structure in the brain that control like hearing, control visual. Sometimes it makes it blindness or deaf. Surgery for brain tumor is only for diagnosis. It's called biopsy. Biopsy sometimes a small incision, sometimes use a navigator to remove it. So the surgery not make the patient harmful, and then we get the diagnosis and then use radiation or chemotherapy. But the tumor that need to remove it completely, it need to open the brain, open the skull and remove it. We have a technique of microsurgery, microneurosurgery to remove the tumor that got less harm for the brain tissue. Or sometimes use navigator help it and not destroy the normal brain tissue. The goal of treatment is make the patient back to the normal life again, or can do it as before the treatment. So if it's small and not cause any abnormal in the patient life, no need to do anything, only observation. But for surgery, we will make it less deficit. People can go back to normal life again.
Certain types of brain tumor can be completely cured. It is vital to understand that various symptoms of brain tumor is not specific. Simply having one of the symptoms does not always mean that it's a brain tumor, and not all brain tumors are cancerous. However, if the conditions are not subsiding for a certain period of time, it is crucial to consult a specialist to find out the actual cause of symptoms. As we are uncertain about the definite cause of brain tumor in the present days, we do not have clear preventive measures that will keep us safe from the disease. However, there are certain brain tumors that have spread from other parts of the body, and the reason is known. For instance, lung cancer that we are aware of its likelihood to spread to the brain, we can take preventive measures to protect ourselves by avoiding these risk factors that may lead to the disease.
Wetany, victory for life. Leave us a comment below if you have any questions, and please hit the subscribe button to stay updated with our healthcare videos.